Hello, this is a rather challenging topic to make. It's a video about trying to make TCM diagnosis easier, if that is even possible. So some caveats before I start. With time, every TCM practitioner needs to develop their own style. The following should be considered guidelines and a possible approach. You will likely need to review these notes several times to get the gist of the approach. Essentially, you have to create your own mind map or your own story. These are my ideas and thoughts. When you form your own, the mental connections and understanding will be unique to you. Another thing to keep in mind is it might make it easier if you keep a very flexible mind. So for example, sometimes some concepts are very linear in a straight line. Some concepts are circular, so that you go around in circle, maybe several circles, to come back to the same point before you form an understanding, most likely an understanding later on. Sometimes you have to view things from the inside out. Sometimes you have to view it from the outside in, or both. Sometimes you're meandering in a number of places before you come to a final understanding. So keep a flexible mind. Now, we can start by looking at diagnosis from as simple perspective as possible. And I thought, for me, I'd use the age range approach, where you've got your infant, child, moving to teen, to adult, to middle age, to older age. So let's start. The basic nature of infants and teen is that they're generally in excess, abundance, and their nature is chaotic, both mentally and physically. Towards the older age, they are more prone to stagnation and deficiency. The adult is a pivot point where, depending on how you've taken care of yourself and your vitality levels, you can either lean towards the healthier state or the unhealthy state. Similarly, when we look at vitality, infants and teens generally have a strong vitality. The adults, again, is a pivot point depending on how they've taken care of themselves or what their life experiences have been. And middle age and old age, the vitality is at risk of decline. It's a natural decline. Treatment options for infants, children, and teens, the options are limited because they likely won't like needles and won't take herbs. So you're left with things like massage and cupping. The aim is to remove pathogens and allow the strong body to heal and reharmonize. Adults, they have the most control over their health if they have the right knowledge and skills. Without the right knowledge and skills, then they are easily prone to get sick. And then heading towards old age, there is a high risk of chronic illness and falls leading to being bedridden, for example. Self-care. So children and teens lack the ability to self-care and can be reckless and careless, whereas adults are more tuned in to self-care and awareness of health risks. And that this factor will highly contribute to how healthy they are as they age. So when does herbal medicine come into play? As I mentioned before, infants and teens will likely be reluctant to take herbal medicine, so we rely on acupuncture, massage, lifestyle change, and allow the body to recover once we've allowed it to harmonize a bit better. Adults, again, it's a pivot point. Depending on their level of awareness and their level of vitality, herbal medicine can be very effective if they're open to it, willing to work with it. Again, middle age and old age, they will have lost vitality and their ability to recover, and their immunity is lower. So that means acupuncture will help, but not as much as acupuncture and herbs combined, and possibly combined with Tai Chi as well, because older people need everything they can get to supplement their essence, so to speak. Moving on to characteristics of organs. So you'll find infants and children, teens, when organs are in excess, it's the lung, heart, and liver. When organs are in deficiency, it's likely the kidney, spleen, heart, and lung. This is a simple way to get you started. For adults and onwards, excess is very similar, lung, heart, liver, and when there's deficiency conditions, there's kidney, spleen, heart, lung, and liver. And noting most of them are internal organs. And we always have to consider all the factors when we're looking at a patient: stress, diet, exercise, family, social, nature, career, trauma, medical history, family medical history, the whole spectrum. In terms of vitality decline profiles, you'll see that when we're kids and teens, the rate of decline is very slow. There's lots of vitality, lots of energy. But once we hit adulthood, especially middle age, the decline without taking care of yourself will decline quite rapidly. But if you take preventative measures, acupuncture, exercise, herbs, tai chi, you're able to slow that decline and in effect slow the aging process and reduce the occurrence of illness. Moving on to simple versus complex cases. A way to approach it is 80% of cases will be simple to moderate and only 20% will likely be complex. So with that in mind, there's a bit more comfort in that, you're not going to get complex cases all the time. And complex cases, normally you have a bit more time to get started from the first treatment, but you need multiple treatments so you get a chance to review over the series of treatments. And of course, there are always exceptions to whatever conclusion we've come to. There are always possible exceptions. Keep it in mind. Now, moving on to another perspective or another way to look at it. When you look at diagnostics, 80% of simple cases, you follow the 8 principles, you follow the 5 methods, you follow the idea of 5 different pathogens that can invade your body. And again, you factor in things like the type of pain, dull, sharp, moving. Is the pain worse or better with pressure? Is the pain worse or better with movement? Those things tell you a lot. And then you can see the rest of the list. Most things are either but dependent on constitution and age, eye contact, chi and blood, whether it's stagnant or deficient, excess deficiency, internal. So as you can see, very basic stuff, but stuff that probably is challenging to remember while you're on the spot. But over time, they will come naturally. And then on the 20% of complex cases, you'll see it's a combination of things: upper, lower, middle jiao, combination excess deficiency, combination internal, external, damp, phlegm, dryness, combination of hot, cold, channels versus organ, structural and functional Shen disturbance. So they're things that you layer on top of when you start simple on the left, and then you layer the 20% of complexity on top, and that might help you approach a complex case with a bit more confidence, you could say. All right, so now that we've got that, I'm going to present another 2 more perspectives, but that would be a mind mapping exercise where I actually, from scratch, draw out my mind map to give you an idea of what you can do with your own mind map. Okay, so the first of the next 2 perspectives cover, it's like an onion, but we're going to start from the inside. So starting from the inside, a patient comes. What questions do we ask to get to understand their situation and story? Okay, we'll start from the inside with: is it excess? Is it deficiency? Is it hot or cold? Is it internal or external? Is it in? Then we ask a question: Is it an acute condition or a chronic condition? Then we go up to the next layer. Is it a Qi and blood or blood deficiency, or is it Qi and or blood stasis? And if we start to look at the symptoms, Qi and or blood deficiency is normally like a dull pain, dizziness, blurred vision, pale and cold in nature, or in symptoms. And whereas Qi and blood stasis is you've got more sharp pain, dark purple color, whether it's tongue or lips or body area, and stasis normally causes heat in terms of symptoms. Okay, so now when we go to the next layer, it starts to get more complex. We start to look at the organs and what the pattern of the organ or nature of the organs means. So let's start with spleen. Spleen patterns could be Qi deficiency, spleen yang deficiency, and the symptoms could be loose stools, fatigue, bloating, damp retention, weight gain, that sort of thing. That's how we start. And then if we move on, if it's a lung condition, is it lung Qi deficiency, lung yin deficiency, lung cold, damp in the lungs, heat in the lungs? And you can see the related symptoms could be shortness of breath for Qi deficiency, phlegm for damp, lung damp, dry, and phlegm for lung heat, and the yellow phlegm for that matter for heat. So you can see we start to look at lungs. Now, if we move on to the kidneys, is it kidney deficiency? Is it yin deficiency? Yang deficiency? Just kidney deficiency in general. And you can see the related symptoms are possibly shortness of breath. There's things as for kidney yin deficiency, night sweating, dizziness, lower back pain. Notice lower back pain also happens in kidney yang deficiency, whereas kidney yang deficiency also has things like pale and cold extremities. Kidney deficiency in general could also be shortness of breath and lower back pain too. I didn't write it down, but you get the gist. Then we move on to, is it potentially a liver condition? Is it liver Qi deficiency, liver yin deficiency, liver yang rising, liver blood stasis, liver Qi stasis, liver fire, and the associated possible symptoms, irritable, pain, stress, etc., for each of those patterns. Then we move on to the heart. Is it a heart Qi deficiency, heart blood deficiency, heart blood stasis, heart fire, heart yin deficiency? And for example, blood stasis can mean chest pains, and heart fire can mean insomnia and Shen disturbance. Again, this is a way to get your brain thinking and I guess not be overwhelmed by all the patterns and symptoms and Qi complaints that you see in textbooks, in lectures, and in other relationships you might note is the kidney is key to everything. So it affects spleen, liver, lung, heart. Liver often affects the spleen commonly. Liver often affects the heart and the lung. And then the lung can affect the heart as well. If you were to think of 80% of the time, what are the organs and the influence on each other? What's happening? Okay. Next, we move on to a different mind map. And again, this is mine. You can copy or you can create your own, make it yours. Okay, a different way of looking at things is we start at the center where there's yin and yang. Okay, and then, actually, before we just going back here, you can, with a patient, you typically have to view things. You start at the center and you go out, but often you also need to start from the outside and go in to get a better understanding. So this onion works in both ways, in to out and out to in, and keep your mind flexible in that respect. Okay, back to this one. All right, now this is another mind map I did, starting with yin and yang in the middle. The next layer, you could say another onion, so to speak. You have function, fluids, blood, qi, essence, and shen. They're all the different, you could say, substances or factors that could influence the health of the body. Moving out to the next layer, you ask, is it a muscle issue? Is it a vessel issue? Is it a bone issue? Is it a ligament issue? Is it a fascia issue, or a combination? Is it more meridian and channels? Is it organs? So that's the next layer to consider. Moving on to the next layer, is it an emotional issue, an internal issue, or more an external issue due to trauma, musculoskeletal injury, and so forth? So you've got an internal, external discussion in your head about this patient, okay? And then this area here are all the possible external factors influencing the body. So is it a pathogen attacking the body? Is it wind attacking the body? Heat, cold, wetness, dryness, damp attacking the body, invading the body? Is it stress on the body, exhaustion, trauma injury on the body? Is it poor nutrition and diet affecting the body? Lack of exercise? Consider the family history, the constitution, the medication and drugs that may have an influence on the body. So those are all the external things you have to consider. And then when it comes for internally generated conditions, I wrote down internally, if there's, for example, blood deficiency, or liver fire, or heart blood deficiency, or they can cause things like internal wind, internal heat, internal cold, internal damp. So that's another mind map that I've created to help me understand it from another perspective. Now, once you've done that, your mind sort of like consolidates. You've only looked at diagnosis so far, but then you can expand that mind map to consider treatment. So, for example, if we take a symptom of stress, and if we find that that is a liver stagnation issue or liver qi stagnation issue, the most related or common herbal formula for that is Xiao Yao San or Jia Wei Xiao Yao San, depending on the specificity of the symptoms. If it's exhaustion, a possible very common formula could be Bu Yang Yu Yi Qi Tang, yeah. And if it's a trauma injury, then a less common formula, because traumatology is not very used often in Australia, is this formula here that, with research and with talking to people, is a formula that can be used for trauma. And they're the herbs that are underneath. But hopefully you can see that your mind map helps your brain have stability, and with stability, a better understanding, and then you build. Those are the building blocks for you to add more. Without good fundamental building blocks, your brain can't cope, and therefore your diagnosis skills can't improve. Anyway, hope that helped. Let me know what you think, and good luck.